Hi everyone, this is John and Eric Iams. We're joined by Primal Reflex Release Technique Instructor Rachel Thiel. Hi Rachel.
Hello.
Hi, Rachel.
Hi, John.
Can we start by giving our viewers just a little bit of background about you?
Of course. So I am a physical therapist in Milwaukee, Wisconsin, and 3.5 months ago, I opened my own cash-based practice after only being out in the field for 5 years. I've worked in mostly outpatient private practice settings and started to find that a lot of patients with chronic pain were coming my way, and fortunately had the blessing to work with some very gifted clinicians at the last office I was in, and that's where I was introduced to PRRT.
Excellent. Now, you probably are one of the fastest students to ever complete all of the upper levels of training. So I wanted to get Dad's feedback about why it was important for us to add you as one of our master instructors. So do you have any input?
Yeah, I think Rachel, you've been unique in that for being out of school as short a time as you have been. You have a clinical acumen that you've developed in a very short amount of time. You can see things in patients. You can hear things when you're talking to them that usually come with many more years than what you have so far. And so this is why we're excited to have you on board as one of our instructors, because not only are you the youngest, but you're probably the most dynamic in terms of the way you present yourself and the way you represent PRRT, which is very much appreciated by us.
Thank you.
Yeah. And Rachel always has great energy. It's awesome to hang out with her and have her around. So I wanted to get her input as to why, for the viewers out there, why it's important to get started with learning PRRT right now.
Yeah, absolutely. I think that right now is a great time to learn PRRT because the healthcare world is a changing place, and when our time with our patients is being potentially compromised or our reimbursement is not quite as consistent or as good as we would want it to be, it's nice to have in your arsenal, in your PT toolbox or OT toolbox, massage therapy toolbox. A lot of different healthcare providers can really benefit from using the PRRT in their practice. To have PRRT as that tool puts you above your competitors. It brings you to a level of the care that you provide that you can expect good results very quickly when you're using the PRRT work, and it gives you an interaction with your patients and clients that you just don't see in most of our new graduates of any of the programs in this type of healing and healthcare environment. And so it's a really nice way to differentiate your practice and to be able to improve your efficiency in working with clients to get them feeling better.
Well said. I couldn't have said that better.
And as far as how PRRT integrates with what they would already know, can you make a quick comment to that?
PRRT integrates very nicely with a lot of the other manual therapy techniques. It also has very strong neurology foundations in that we're looking at the reflex system, we're looking at primal movement patterns, we're looking at the reflexes that we've integrated into our adult level function. And so it takes those foundations and it applies it in a way that you can integrate very quickly. So anything that doesn't seem like it's releasing quite fast enough with the soft tissue mobilization, you can use PRRT on, or you can treat with PRRT in that region to be able to create a very nice release. And so it's a nice way to take some of the pressure off of your hands as a clinician, but also to get a whole regional treatment effect for your clients. So it's not like you're throwing out everything you've already learned. You're gaining from the PRRT work another tool to be able to optimize the results you can get with clients.
Great. Now, this is a super rare opportunity for people because what we've come up with is an accelerated level 1 program, and we're gonna add that in combination with the level 2 program. So it's going to be a 3-day course, right?
Correct.
Yeah. So the reason we're saying this, did you have a comment? You can go ahead.
Oh, I mean, I can comment. I think a huge value to adding it in the 3-day course is that, one, you don't have to travel to 2 different courses. So it saves you as a clinician a lot of time for being able to go to a continuing education program. But what it does is it allows us to highlight the key components of the assessment of NSRs, of pain regions and pain patterns that are really integral to understanding how primal reflex release technique works. And so we'll be doing that on day 1 with the level 1 content. And then as we progress into level 2, we'll build how that assessment turns into your treatment approach with using PRRT, and you'll be able to see how to integrate it on your clients within those second 2 days.
For someone that's interested in joining you for the weekend, they don't have to attend all 3 days. Now, if they combine the level 1 and level 2, they're going to save. But if, for example, they want to start out with just the level 1, they're welcome to join you for the Friday session, right?
Correct. So based on where you are in your training or availability to get out of work to come to the training, you can do, day 1 by itself, which is Friday, or you can do only Saturday and Sunday to get the level 2 training. If you want to hang out with me for 3 days, I hope you choose to, then you can do all 3 days.
Great. Yeah, and just so they know, we'll have registration information below for all the different options. Just quick, so that they know, you're going to be there mentoring them, and they'll be able to interact with you throughout the weekend and have you there to help them with the practicing of the techniques, correct?
Correct. So that'll be a nice way. Usually we keep it to a pretty good ratio of instructor to students. So there are a couple clinicians that are well respected in the area that if we have a larger number of people that are able to attend the course, so then I will bring in an assistant that I've worked with, probably actually my business partner, who's trained directly from John as well in PRRT. And then a very nice thing that I always think is great is then I'll coordinate with John so that he'll actually call in and be able to talk with us as we're going through the course.
Yeah.
I look forward to that. That'll be great.
Yeah.
Yeah.
And then will you also have time, as time permits, to evaluate and treat some of the attendees as well?
Yes, that is a goal of mine and an intention, that to come to a course where you don't have to worry about leaving in more pain than when you came in, and to not be afraid to let somebody practice the techniques on you for fear of triggering a migraine, which is a personal experience with my mother that I can relate to, is a very nice piece of what you can expect with PRRT, that will work to get everybody that attends some level of pain relief, whether it's from practicing or ideally being able to zone in on an area of pain that you've had as a clinician to actually get that treated and resolved.
That's a major added benefit to attending, to have that opportunity.
Mm-hmm.
Yeah. Well, at the time of filming this, we've already had a few registers, so don't hesitate. Save your seat. Again, the registration information is below. We're very excited for this awesome opportunity. We know you're going to have a great weekend, Rachel. Thanks so much for joining us.
Yes.
Thank you.
Thank you.
Thank you.